Welcome everyone to the final Impact Meetup of the first series of Impact Meetups that we've been having here at LSE. I'm Liz Stokoe, Professor in the Department of Psychological and Behavioural Sciences and Academic Director of Impact. And the aim of this series, for those of you who've been before, will know already, it's to hear from colleagues and their external partners who have experience of and lots of expertise in working together to create change, impact and benefit from research. We're recording all these conversations that we're having in our meetup so that others can understand the components of research impact, from engagement and partnership building to actually collaborating, the ethics of it all, and just changing things in the world. So today I'm really delighted, especially as a map nerd, to welcome Alexandra and Jeremy. So Alexandra Gomes is a research fellow at LSE Cities. She's responsible for coordinating spatial analysis across a range of projects at the centre. Her expertise spans socio-spatial comparative analysis, urban policy, inequalities, health, sustainable mobility, public space, urban sensescapes, and visual communication. That's a really interesting mix of stuff that you're expert in. Jeremy Morley was until recently the Chief Geospatial Scientist at Ordnance Survey. And at OS, you led the research team focusing on commissioning, planning, and executing research projects with universities, promoting active knowledge transfer and horizon scanning to identify new business opportunities and emerging research. And before that, you were an academic at UCL and at University of Nottingham, focused on geospatial science and technology, with lots of links to industry, through the association from Geographic Information, EuroSDR, and the Open Geospatial Consortium. We're so excited to hear from both of you, really am. And I know that the two of you, amongst others, have worked together on a project called Deconstructing Health and Wellbeing Through Data, and this was a project that was funded by the OS, a part of the Public Sector Geospatial Agreement in collaboration with NHS England and also the Data Science Institute here at LSE. So it's just really such a pleasure to have you here for this very important final event in our series for this year. Before we get into your collaboration, maybe just tell us a bit about your individual careers so far, a bit about your background, anything you'd like to share with us so far. Alex, you go first.
So I have a kind of multidisciplinary background, which I think it's what supports being here at LSE, in particular at LSE Cities. I did engineering, kind of urban engineering, but then I always felt, yes, I know how to, at the time, I forgot a lot since then, but at the time, you know how to build infrastructure, create the structure of the cities, but then how does that impact the people? So I decided, okay, I need to study a bit of sociology or anthropology, some social sciences. So I went to do sociology, which is a master's, at the time more linked to public participation, which I thought was something also that was missing, in particular in Portugal, where I come from. And then eventually, later on, I came to the UK, and I think I decided to explore urban design, because then it's how about not only the infrastructure that often supports the city, but how the framing of the buildings and the transportation, impacts on those who live here. So I think I always try to explore a bit more within planning. So there's a kind of an umbrella of urban studies or planning studies, but I always try to bring a bit more to it, because I'm always curious, to be honest. I think because I wanted to be a detective when I was a kid. And I was like, okay, maybe not the police, but I think research is a kind of the approximation of being a detective. And then in terms of my career, I got here, like a friend of mine said, it's kind of a, you try to make sense of a piecemeal career. So I did a bit of GIS, I did a bit of research, I did planning and development planning. I worked in the tube, mapping the grid of the metro here in London. And in a way, then with the PhD and the masters and the undergrad, I think what made sense was LSE Cities in a way, and bringing all this together into a multidisciplinary or transdisciplinary center And then, of course, I met great people and started collaborations with other departments within LSE. Yeah.
Great. And yourself, Jeremy?
I started in kind of natural science and mostly physics, and as part of my degree there was things there to do with satellite Earth observation as a kind of third-year option, and I described myself as being a child of the Voyager program, which was a space program with probes that went out through the solar system, and that really inspired me at the time. But I thought, well, planetary science, maybe there's not so many jobs in that, so I'll go into Earth observation instead, and went into kind of remote sensing MSc. And from that, through kind of Earth observation, kind of led into terrain mapping, and from that into kind of geospatial more generally, and then into the technology around it, and so on. So from that route has kind of expanded into the geospatial kind of space, I suppose. And at UCL, that was particularly in engineering departments and so on. And the move to Nottingham then was a interesting joint appointment between a faculty of engineering and a school of geography, and a 50-50 thing, which was a benefit and a curse. You know, it certainly expanded my horizon from an engineering perspective to include more of the social aspects of geography and so on, and allowed some research to be on the technical and some a bit more on this more qualitative side of things. But it's an extremely difficult thing at a university, being the subject of two masters. Everyone wants 100% and so on, rather than 50% each way. So eventually then, I suppose the Ordnance Survey Chief Geospatial Scientist job felt like a job with my name on it, that it was looking for the industry connections and the academic connections and so on. So that was 10 years of work in that job, and yeah, really it flips the equation in many ways, that, you know, in academia you're interested in, you know, research quality measured through papers first of all, and then impact too. You know, it's the other way around in that job at OS. You're interested in what's the impact going to be and what's the relevance for OS, and demonstrating some of that through kind of papers and so on is a kudos as well. So it's, you know, it's an interesting inversion of those things, but still allowed a lot of contact with researchers, PhD students, that kind of world of stuff. And kind of at OS, you know, our interests, I'm still going to say our, despite not now being there, our interests there have spanned things you might expect, like how to make maps better and how to collect the data better and so on. But also there's the what is geospatial information, the actual kind of digital data going to be used for in the future, whether it's better analysis in the public realm, all the way through to how does it fit into the world of, say, driverless cars and things like that. So it's an interesting kind of span of research across those application areas as well as the central technology itself. So even after 10 years, I feel like a bit of a recovering academic, but definitely that flips the interesting part of it, I think.
Well, we might come back to the difference and similarities between academia and outside of academia later. But maybe now you could tell us a bit about how you actually came to meet.
Yes.
Jeremy, go first,
yes.
then Alex can
I think it's a triumph of business development. I think we'd both cite Lou Flandrian as the person who put this together in the first place, of kind of coming to us at OS to ask kind of what some of our interests were. And at the time, we were interested in that, in the realm of kind of the interface between public health and health outcomes, not having people going to hospital by intervening earlier, and the relationship between public health and local authorities and so on. So it was something we were interested in and starting to look for project work. That some of the research at Ordnance Survey is funded through our kind of government contract as a national mapping agency. And so kind of Lou thought, aha. And, and maybe Alex, you can tell the second half of that, yeah?
So as a background, the LSE DSI Data Science Institute was created. And at Cities, everyone was talking about it. I was like, what is it? What is it? It was just something new. And then I went to the website and I was like, well, I can connect with them. Why not? I use data. I create visualizations, often maps, using GIS. And I think I can contribute somehow, not so much onto AI, and I'm not a data scientist, I'm more like a data analyst, but I kind of can contribute. So I submitted a form saying I would love to be your affiliate. And I think that's how it all started, because then probably Lou met me through that form. I don't know if she will explain better. But it created a kind of a opportunity there, because I think there was an opportunity, because I had worked in a project looking to urban health and neighborhoods in South London. I worked with maps, and to be honest, most maps that are created looking into Great Britain or London in particular, in this case, in my case, use Ordnance Survey data. So again, there was a great combination of their interests, my interests, and Lou being the mediator of these interests. And
I think a key thing, the key components of this were being put together in the first place, but being in a place like LSE, which isn't just about kind of geographic information or whatever, but has that wider kind of science and economics perspective, and Alex's previous kind of work in this area was kind of the mix that made it work.
Yeah, I think a lot of research is very quantitative and numerical, and what I wanted was to bring the side of the spatial side, but from the perspective of social sciences, which often it's starting to happen more, but before it was something that was a bit underrepresented. And I think the opportunity to work with the institution that provides most of the data, spatial data, that I had used in the previous project, into something that can bring something for also the OS, was quite exciting. And then we had, I don't know.
Yes, ultimately kind of OS is a quantitative type of organisation that we make digital data and services on top of it, but nonetheless, in a field like health and health impacts and so on, the kind of socio-political realm is really important, obviously really important feedback in that system, and so having some connection to that and understanding of that seemed like an important component here.
I still find it quite nice when I reflect on the Ordnance Survey workshops that we went, and Sarah, who's working with me on this project, we went to present the project, and we were one presentation in one slot, because everyone else was more towards engineering or data scientists, and then the social science was like one presentation. And I was feeling a bit awkward, like, are they understanding what I'm saying? Like, it's a completely different approach to using data in a way, or talking about data. Not only using
some of those social science aspects are buried in some of the more data-related projects. But yes, this is definitely one extent to that.
Yeah.
Lou, it sounds like you were quite a big part of this story. Do you want to just say a few words?
No, let the experts talk.
Oh, we might come back to you later.
But I would say it is an art. Good business development. We, having been on the end of lots of universities and lots of business development and people trying to put you together, there's just a couple of places where it really works well, and actually here in Swansea, strangely enough, have particularly good business development managers and it's not, and I mean that in a really positive way, of actually understanding how to connect things together.
Yeah, a good matchmaker is a really good thing.
Everything in life.
Yeah, exactly. Yeah, could you just say a little bit more about maybe the translation of the more social science language into the quantitative world, and what barriers you might have come up against as part of your wider collaboration, maybe?
So I feel that one complex thing that we try to translate is to visualize the complexity of using data. So the first year we spent a big part of that year trying to understand the complexity of data relating to with our, health and well-being. So it's not only the spatial data, but also the individual data, who are we, but also within the individual, who do we live with? Do we have families? Do we have a partner? Do we have support? In which neighborhood do we live? Is there a neighborhood that has particular values? For example, I work in Kuwait. The values are car centrism. So you have to, when you're approaching urban health, you need to understand that the values are specific, right? And then also, how does this also link to behavior? How do people behave? What's the importance of behavior? And then, of course, the politics and the politicians, and one thing that we kept discussing was that how do we talk about time? Because politicians have to act in 4 years. So how do they use data in order to prioritize interventions if you have 4 years? And then actors and that come and request for changes. So this shows a complexity of the data that has to be talked about and discussed with policymakers, with academics, and translating that into a visual or into an article is not that easy. And lately, in the second year of the project, we look into how people, what people value in public space, in parks in particular, and then how can we use, for example, spatial data to help measure that value, even if what they value is something emotional. So how do you translate what people say, that it's perceptual, emotional, into something that can be measurable and can be translated through spatial data or numerical data? It's a big challenge. And I'm not sure we'll get there effectively, but I think the goal is to start discussing that we need to somehow highlight that this has to be done to understand inequalities, right? And you have to somehow create a system that reveals how some spaces are more important for people, or some elements of the parks are more important for people. So there's a combination of translating the complexity and the interrelationship of these elements, because we always have the example of the tree. If you put a tree in the middle of a sidewalk, you might be influencing, yes, the environment. Maybe it's good in terms of the environment, but if you put it in the middle of the sidewalk, you might create problems for people with wheelchairs. So, the translation of this complexity is fundamental, and then the social side and the emotional side and perceptual side within the whole analysis of a particular case study was also another challenge that we had. I don't know if you want to...
Yes, I agree with all of that. I think there are two sorts of complexity, I think, in the kind of qualitative, quantitative sort of interaction here. In the end, if you're talking about kind of influencing policy and spending, spending in the end comes down to something quantitative, which is kind of pounds and pence and so on, and measurable things like numbers of trees or building a wing on a hospital or whatever else. So, but a lot of that system is inherently kind of socio-political as well as kind of physical environment. So it's how you map together all of that into one system, I think, is maybe still a bit unanswered in this project. The levels of feedback and complexity here are, we can show the complexity, but I think actually trying to model the entire feedback range is probably as complex as trying to model a planet's environment, because the interactions are so kind of complex and multi-level and a little underrepresentable as well, But nonetheless, I think also a lot of these interactions happen in places and spaces and locations. That example of, do we put trees along a road to improve air quality, or do we put electric charging points? And maybe it's one or the other, and what's the different value and what are the different side effects of both things? That argues towards data, it argues towards the importance of that kind of geographical information to do that modelling. So even if some of the complexity of the feedbacks is a difficult subsequent challenge, there are actually things you can get on with now, and maybe you measure some of the outcomes and start to understand the complexity of the feedbacks, And some of it's going to be out of your your control anyway. You know, what happens in politics, I suspect, is not an easily modelled thing. You know.
So I can understand how you came together as two different organisations or institutions via matchmaker Lou over there. But can you say something about your particular expertise that you thought we have, you know, in the broader scheme of things, these are the particular things that I do, and these are the particular things that I do or I'm interested in. These two are going to work together. What were, for a layperson, what were those things?
So one thing that I'm particularly interested is understanding spatial inequalities. And I think you can only understand spatial inequalities when you have data. So there's a big link here between spatial data and spatial inequalities. So, and also I think health is a very broad concept because it includes a variety, like I said, it includes people, space, behavior, et cetera, policies, politics. And I think I'm also interested in this complexity because I feel that a lot of the times it's the values that count, not the people, not, you know, not the space, but what people think it's important because they, you know, like the case I said of Kuwait, they feel that investing in roads is what is important. So it's not about the people themselves, being individuals or living in a family or the space, because the space can accommodate other type of behavior and investment, but there's the value. So in a way, and that creates inequalities, that fact that there's different values that create inequalities. And I think what I wanted, I think that is what I want, and I want to understand is how different elements combine together to create inequalities in space, and that affects probably different people in different ways. And the combination of that with, I think, working with the NHS, because this was a collaboration with the NHS, and Rob, I have to say his name, Rob Shaw, he's also someone who thinks a lot about space and how space can contribute to better or worse health. And he always brings us these examples that instigate discussion and debate. And it's very much related to the same process of thought and the same outcomes, which is to prevent in a way that people get to the NHS rather than mitigate. When they're in the NHS, then yeah, you take care of them. But if we can avoid and having people, like, for example, how do we think about trees to avoid hay fever levels? Or how do we think about trees and where do we place them to avoid problems of mobility? How do we think about trees and maybe there's particular types of trees that are much better to capture carbon? So all these things will create, in a way, or mitigate the chances of people getting to the NHS. And then, of course, because all these, mapping the trees and the type of trees and the location of the trees and the size of the sidewalk, it's also important for the Ordnance Survey. So there was a kind of a combination of the spatial side of the research, the human side of the research, so, and the inequalities, and also trying to have an impact somehow. And if that impact already helps one person, it's already a good thing.
Yeah, for us, our context is of being a kind of public organisation, and particularly through this Public Sector Geospatial Agreement of which is our kind of contract that sets us up as a kind of national organisation and so on. Yeah, we're always looking to kind of expand the uses of our data, and then secondarily also enhancing that data to serve different communities better. And I suppose we were bringing to this some of that contact with NHS England already, particularly with Rob, you know, and there have been ongoing discussions about kind of the modelling of things in the health domain with them, and better ways to just do that. So the opportunity then to look more broadly at these issues of kind of mitigating health problems before they accelerate into kind of NHS referrals and so on came up. And at the opportune time of having had this discussion with LSE and becoming aware of kind of Alex's side of it, of that interaction with the social domain, it just seemed like a good pairing where we were bringing the geospatial data expertise and looking at all those things about the kind of layer of information you bring to build that modelling, and some established work with the NHS, the pairing, or in fact the triple interaction just seemed to work really well.
So can you tell us a bit about what you actually did in a nuts and bolts type way together?
Yes, used to. Okay, fine. So I think it's been a series of steps over the last couple of years or so. I mean, the first steps really were to try and understand the domain and the complexity of those interactions. And you might expect something that is starting in the academic domain of actually looking through kind of literature and understanding the sorts of modelling that has been done in this space. But I think what was really interesting to me in kind of Alex and her team's approach here is not just kind of writing a big long literature review, but actually starting to produce some interaction diagrams that showed how factors and interventions kind of related together to start to understand that kind of realm of complexity, both by domain, things in the social space and the political space and the environmental and the just the geographical spaces, and looking at all those interactions. That starts to build the picture of the complexity you're trying to deal with. And then diving into air pollution a bit more, kind of particularly to start to draw out also some of this kind of spatial data needs, and what the interaction diagram is great, but is very high level, and so having something specific to work on in that first year of looking at kind of air quality was really important. And then I think moving on from that, this last year has been to look a bit more specifically at kind of one facility and in this case kind of public park spaces, and looking at what makes a difference between kind of different parks and different uses of it, and what people value, and that kind of understanding both the emotional and the social and the physical geography and the interactions around some specific facility has really helped kind of give some specific focus in an instance like that. So that's kind of been the trajectory. I don't know what you add to that.
That is exactly it. I think it kind of went from some kind of a broad perspective on data, how to deconstruct health and well-being through data, which is exactly the title, with this systems approach. And then we had a little bit of time to then explore the air pollution. And we really wanted to, for example, ask the question, is it better to plant 100 trees or to reduce 100 cars? And we've realized that it's impossible to answer this question, because it depends on the street, depends on what cars, depends on 100 cars in a day, 100 cars in a year, depends on the weather, depends on so many issues that, we ended up using that case to highlight the complexity. Because in most of the interventions that exist, and this is only from literature review because we didn't do empirical work, in most interventions of air pollution that exists from this literature review, the complexity of factors is so big that you can't really say, 100 trees are better than 100 cars, or the opposite. It might happen that...
in a real life case, I think you'd have more kind of boundary conditions, if you like, or more kind of factors you can't change, like what's the council's budget and what are the councillors or whoever trying to achieve with this. You need to understand your measures that you're trying to come out with, and in abstract, I think it's a difficult thing just to say on its own that all of this is embedded in some sort of target space of the political, social domain and who's paying, and there's always that complexity as well of of course, the NHS wants to reduce the number of people coming to it so it can reduce its budget, but it's the local authority who's going to be paying to reduce somebody else's thing. And so there's a really interesting interaction there in that kind of socio-political space of one person's benefit being another person's cost, potentially. And do you have enough of a political view of the whole system to understand how those things trade off? And so just saying, is 100 fewer cars and 100 more trees a good thing depends so much on that framing, ultimately.
So in terms of things that you've found, including things that you've discovered you can't find out a clear answer to, how have these things that you've come to decide are important together actually started to change things? Like who have you been influencing? Who have you have, for example, you managed to get NHS referrals down, or like what are the more tangible impacts of your work so far on whom? Short term, medium term? Do you have plans for longer term?
Well,
yes, you go first. You've got some specific things to talk about.
I think also, this project is still ongoing in a way, so we are in a way starting the third year. So I think thinking about already impact of this, it's to be honest, it's not feasible because it's still ongoing and we didn't present it that often. There's still, we don't have physical outputs yet, so there's a bit of conversations. In a way, I think this discussion, I hope it has also with Rob being from the NHS England. We are meeting him tomorrow exactly to ask him, what type of impact, what do you think this brought to you? So we'll have that answer tomorrow. But I think we are now in a phase where the type of engagement with policymakers and academics is growing. So, for example, we've been working with Louise on the wall for the exhibition, coming from the project, the first year project. So we'll have a wall where we present the case of a tree. And
say what exhibition?
The LSE Festival exhibition, starting on the 16th. And so in a way that will be our first big impact output. I'm also liaising with LSE Coms, and we'll have also part of the LSE Festival, meetings with councillors, speed research meetings with councillors from 6 different areas of the country. So, this is kind of a first step now to liaise with policymakers, to other academics through the festival in particular, but then also, potentially more presentations in academic conferences. This, who knows who's going to watch this? So then we'll see the impact of the project. But I think you already presented a bit of the complexity, the system in one of the conferences you went.
Yes.
So maybe.
Yeah, I was going to say a bit more about the OS side of things. And I think, as Alex has said, this kind of phase this year has been a bit more focused on kind of bringing it home, so to speak. And some of the work in kind of tracking some of the various kind of factors, as I said, that interaction kind of diagram, started to produce, what are the actual pieces of kind of map or geospatial data you're going to need to understand those different factors and elements, and that we're starting to kind of map against data sets that OS produces and whether they're capable of mapping the things that you'd want to get to in that or not. So for us, it's getting down to some kind of nitty-gritty, which we wanted, of what's in the data and what isn't. So that's going to require a bit more interaction with kind of the experts at OS about data contents and so on as well. So, yeah.
If you could have a sort of dream impact statement 5 years down the line, what would have changed? With no commitment, just like if ideally you would like to see as an outcome in 5 years, this would have happened.
You start because I said such a hard.
I think for me, it's all of these things come down to kind of evidence base in policy making, and that whether it's councillors or ministers or whoever have some means to understand secondary impacts of policies and putting that into assessment. It's probably a bit too much of a dream to think like Green Book assessments of projects might include some of those kind of secondary factors a bit more and interactions, but that's the sort of space that it could fit in. Not just to think, if I produce a 15-minute city or 15-minute neighbourhood, everything's going to be great, but what else will happen as a result of it? Just to allow people the opportunity to think through those things, and even better, having a modelling way to do that would be great, I think.
I think in terms of impact, I think if we change, we create a space that is less unequal through these discussions, because people think about it as a system on the feedbacks they have, or in the case of the second year project, also on the emotional side and perceptual side, for example, of using parks. And we have this little story. Sarah Luxmer is working with me on the second year, and we have this little story of one of the parks in Haringey that has a traffic model area built around the 50s, 60s, I don't remember exactly and it's not being used that much. But it's from the interviews and surveys we did, everyone highlighted the value. And again, the value is important, the value of that area. As something very special, because it's part of the heritage, it's part of the park, of the history of the park. It creates a uniqueness of that park compared with other parks, but it's not very used. And when we had the interviews with park managers, they were like, oh, we were thinking of maybe taking the traffic model area and putting more green, or using that in a different way. We didn't know people valued that much. So in a way, this is already impact. They are now, by coincidence, because we are doing this research and because the people responded so heavily on how special that element was, they are now aware of, okay, it's not only about the use of stuff. It's also about the value of things. It's a bit like the heritage of the park. So if we can, through this work, highlight the complexity of things, that not always what's not used is not important, not always, we also discussed the crime statistics, not always you feel unsafe in a space that, the fact that you have no crime statistics, that doesn't mean that, you can feel safe. And in particular, as a woman, I have some needs, right? I need a space that has a lot of light, It doesn't matter if there's no crimes committed in that area. So in a way, highlighting all these aspects, emotional aspects and psychological aspects, and the placemaking of spaces and the importance of that, together with the balance of understanding the complexity. And when I discussed in a workshop where I was presenting, and I used a bit of this research, and I talked about, we often forget that politicians have 4 years to decide. And one of the people who were the participants was there. He was like, I'm from a municipality, and no one ever talks about that. We don't have enough time to do research. We have limited budget. We have 4 years to show things. So we can't choose only what's better. We have to make a cost benefit of what we can do in those 4 years. So, if we highlight this, and if people recognize that that helps them to negotiate, discuss, and if that also helps the Ordnance Survey create data to help that, then I think it's good.
I think maybe of specific kind of impact that might kind of smaller on the scales than some of these things, but I think still could be interesting out of this from this last year's work might still be a kind of public space or green space value index that tries to measure some of the kind of quantitative or qualitative things about those public park spaces to allow a better kind of evaluation of of value.
Yeah, because for example, I don't know who here in the room knows about the index of multiple deprivation, which is an index that we often use, at least I often use when I work with spatial data. And we were thinking, why is there not something like that in terms of green spaces? You know, how are is this green space something that brings something to you more than that one? Why do you choose that park rather than the other one? Or, you know, if you have 20 parks, would one bring something extra to you or not? How do you measure how that park is contributing to the health and well-being of the people in the neighborhood? And Ian already put me and Sarah in contact with the ONS, who did the index of multiple deprivation. They're thinking about value of green areas. So that could be a future, who knows, opportunity of creating some kind of impact by, you know, supporting them the way they see better.
It was just apparent, even at looking at 3 parks in the Finsbury Park area, that, you know, there are all 3 are valued, but for different utility factors. You know, big parks versus little neighbourhood parks, and you know, kind of big green spaces versus a place with a pond and ducks. You know, and
animals are a big thing, by the way.
Yeah.
People love animals. If you have a park with animals, I never thought about it. Of course, I like animals, but I never thought that, because animals engage with adults and kids, and that's a very special thing for people. So understanding this, you know, I don't know if it's unique. Maybe it's not. Other people discuss this, but I think, you know, what we aim is to use this to then help other institutions in the way they work with space. Yeah.
That seems like a good moment to just pause and see if we have questions from the room.